This screencast presentation is composed from the following team members: Leslie, myself, Nelia, and Gloriana. Today, we are going to present a screencast about health policy issue that is having an impact in our work setting. It is how poor literacy skill might impact patient safety. The first part of this presentation contains a brief definition of health literacy, how they impact patients' ability to function effectively in healthcare environment and act appropriately on healthcare information. It also presents an overview of health literacy, law, standards, and regulation that promotes effective communication across the entire healthcare continuum. The second part of this screencast is going to be presented by Nelia, while presenting various cases example on how policy literacy skill might impact patient safety. She's going to talk about health policy in hospital setting, the purpose of this policy, policy development in hospital setting, how leaders behave, and how followers respond in the policy development process. The third part of the screencast is going to be presented by Gloriana. She is going to briefly present Porter 5 competitive force and how Porter's forces 3 to substitute and bargaining power of buyer relate to health literacy. She's going to discuss the need for new policy in health literacy, leadership style, implementing new policy from CEO and follower perspective. That is matter. Well, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services in order to make informed and appropriate health decisions. When we use the term health literacy, we are talking about more than just listening, speaking, reading, writing, and math skills in the health setting. We are talking about the use of those skills and others such as analysis and decision making in order to navigate the health system, assess and understand health information, and make decisions on health. Most people with low literacy can read words and short sentences and do very basic calculation. However, they might not understand all what they are reading, especially complex and unfamiliar information. In addition, they might not know how to use the information in their daily life. Health literacy represents a constellation of skills necessary for people to function effectively in the healthcare environment and act appropriately on healthcare information. According to Berkman in 2011, this skill includes the ability to interpret, document, read and write prose, use quantitative information, and speak and listen effectively. To maintain and improve patients' health, it is essential that individuals comprehend oral and written information. Based on Hester in 2005, he said, poor literacy skill has been associated with increased hospitalization, poor treatment outcome, depression, and increased mortality level in patients. People with limited literacy are at risk of medication mix-up and dosage error. An example of this could be when a doctor says to a patient, take this medication on empty stomach 1 hour before and 2 hours or 2 hours before meal. The patient who has poor literacy skill can have the risk of mix-up medication and dosage error. This is an example of how poor literacy skill can impact people's life. There are healthcare literacy, law, standard, and regulation that promotes effective communication across the entire healthcare continuum that enhance effective patient-provider communication. Healthcare administrator, patients, provider, and professional need to be aware of the relevant laws, standard, regulation, and guidance that address patient-provider communication. These are the Joint Commission, the Patient Protection and Affordable Care Act, and the American Speech Language Hearing Association with the abbreviation of ASHA. The Joint Commission, new standard effective on January 2011, promotes effective communication, cultural competence, and patient-centered care. The new Joint Commission standard addresses effective patient-provider communication. This standard promotes effective communication with patients across the entire healthcare continuum from doctor's office, emergency room, clinics, ICU, acute care and rehabilitation hospital, home health service, and hospice when providing care, treatment, and services. Examples of communication need include the need for language interpreters, personal devices such as hearing aid, glasses, communication board, and devices. After the patient communication needs are identified, the hospital can determine the best way to promote two-way communication between the patient and his provider in a manner that meets the patient's needs throughout the continuum of care, where the patient and healthcare provider exchange information, enabling patients to participate actively in their care from admission through discharge, and ensuring that responsibility of both patients and provider are understood. According to the U.S. Department of Health and Human Services in 2010, the Patient Protection and Affordable Care Act required that hospitals inform patients of their rights, including the right to make informed decisions and patient in the development and implementation of the plan of care. This law incorporates provisions regarding learning how best to communicate with consumers and patients, encouraging all stakeholders to address health literacy across the continuum of healthcare. Providers have a legal obligation and responsibility to overcome communication barriers. It is important for providers to recognize that poor literacy skills might impact patient ability to function effectively in healthcare environment. The American Speech Language Hearing Association, ASHA, is working to educate members about health literacy so that the message can be understood and spread to wider population. The vision statement is based on making effective communication, while ASHA mission statement is to empower and support SLP, audiology, and hearing scientists by advocating on behalf of people with communication and related disorders and promoting effective human communication. The second part of the screencast is going to be presented by Nelia. She is going to talk about health policy in the hospital setting, the purpose of this policy, policy development in the hospital setting, how leaders behave, and how followers respond in the policy development process. She's also going to present various case samples on how poor literacy skills might impact patient safety.
Hi, I'm Nelia Garcia, and I will be presenting various aspects of policy development in the hospital setting, highlighting the concept of health literacy. Health policy in the hospital setting. What is the purpose? Formalized written policies and procedures fulfill a number of important issues. They facilitate adherence with recognized professional practices, promote compliance with regulations and accreditation requirements like CMS conditions of participation and Joint Commission. It reduces practice variation, standardized practices across multiple entities within a single health system, serve as a resource for staff, particularly new personnel, and reduce reliance on memory, which, when overtaxed, has been shown to be a major source of human errors. The policy development in the hospital setting, the leader's role, includes healthcare risk managers and other senior leaders. They oversee policy development, approval, and a periodic review by the appropriate policy owners. Leaders also need to create tracking mechanisms to identify when policies periodic review is due in order to assure timely response. Leaders issue policy development guidelines and train managers in their use. Leaders also create policy and procedure oversight committee with multidisciplinary membership and representatives from all entities. Leaders incorporate training about policy and procedure compliance in new employee orientation programs and ensure a discussion with all staff members. Moreover, they implement feedback mechanisms so staff can report situations to management that might need to be addressed to reduce any patient harm. They also are involved in policy revision, and usually they designate a committee that will compare new policies with those already within the health system to determine the need for modifications or the creation of new ones. This is an illustration of a real case of a health literacy issue in the hospital setting. This image represents a patient that misunderstood the recommendations to elevate the feet above the heart. This is a real case. It's just, you think it is incredible, this is not going to happen, but yes, this happens. Also, in this one, this is another example of a health literacy problem in the hospital setting. A patient, in this case, misunderstood when a doctor informed him that his results were positive, and they were not positive in a good way. One example that I can illustrate and describe from my work setting that has to do with health literacy and policy development happened in the speech pathology department. Um, we were concerned about many situations with health literacy, especially with the elderly patients. They were demonstrating poorer treatment outcomes due to difficulties understanding speech pathology diagnosis and recommendations. For example, we as speech pathologists, we might evaluate a patient and we will recommend different diets and modifications in those diets, in solids and liquids. And we do that to increase safety during the feeding process and to prevent them from having aspiration episodes that could result in aspiration pneumonia. But sometimes patients' lack of understanding of the rationale behind it, and it had resulted in poor compliance, which in which patients started eating and drinking consistencies unsafely, not because they didn't want to adhere or to comply with our recommendations, just because they did not understand the condition that they were having, the problems that they were evidencing, and a few of them resulted in aspiration pneumonia. In this case, the follower's role, it was ours, the speech pathologist, and in order to create change, we presented our concerns to our managers, and we provided solutions based on evidence found in the American Speech Language and Hearing Association regarding health literacy and how to create materials that were clear, using illustrations. And we also look for the Joint Commission recommendations. We presented all this information and we were able to delineate ideas that shaped today's guidelines in our hospital. On the other side, the leader's role, when we communicated all these situations and issues to our manager, she was able to discuss all this information, our concerns, with directors and administrators. It took a few meetings, but they resulted in a new policy where illustrated material with clear explanations of patient conditions and recommendations were created. Also, nurses, patient care techs were trained in safe feeding and aspiration prevention strategies to reinforce better patient care and education. And since the policy approval, new employees that are involved in direct care with patients are trained in aspiration precautions, diet modifications, and safe feeding strategies. And now Gloriana will continue discussing Porter's 5 competitive forces.
Hi everyone, my name is Gloriana. I want to introduce the Porter's 5 competitive forces and how those forces are related to health literacy issues. I want to mention some of the competitive forces and I want to add some characteristics of each of them. Let's start with threat of new entry. In threat of new entry, we can see time and cost of entry, specialist knowledge, which is very important in a clinical setting because it's strictly related to the clinical expertise of the clinicians. And we can mention here economy of scale too. Let's go to buyer power. In buyer power, we can see number of customers, differences between competitors, and we can see price sensitivity. Let's go with threat of substitutes. In threat of substitutes, we can see substitutes performance and cost of change. And finally, in supplier power, we can mention number of suppliers, size of suppliers, and uniqueness of service. That uniqueness of service is a very important characteristic too, because this uniqueness will distinguish one clinical setting from another, bringing the opportunity to the person to identify which of the clinical setting is best according to their needs. Let's go to Porter's 5 competitive forces, and we choose 2 of the 5 competitive forces that are related to health literacy issue, and I want to give some examples in the clinical settings. Let's start with threat of substitutes. In threat of substitutes, we can see how the patients and the subjects can move to another institution or organization if the institution where they are do not provide them the clear, concise, and correct health literacy policies. In bargaining power of buyers, the case is a little bit different because here we can see how patients and their families will force and pressure the institution to move, to change, to make changes in the health literacy policy in order to stay in that organization. We can see threat of substitutes in the 5 competitive forces related in health literacy in the following way: lack of guidance, lack of health literacy policy, and this is one of the reasons that the patients will move to another institution. And the lack of health and literacy policies will provoke an impact on the quality of services. And because of that, patients can feel that there is a lack of commitment to them. In the bargaining power of buyers, we can see consumer pressure in order to provoke that policy change in policies, and better guidance. In the clinical settings, we are always looking to do the things in a better way. So, need for new policy in health literacy. We need to look for positive changes that will benefit their patients and families, and how we can change policy in health literacy. How can we relate a leadership theory that reflects the leadership style in implementing new policies? We think that transformational leadership is a good example because transformational leadership theory or style is the type of approach that causes change in individuals and social systems, and we need to provoke that change not only in the individuals, in both individuals and social systems that include organizations, institutions, health policies in the different clinical settings. Valuable change in the followers. That transformational leadership style will provoke a positive change in the followers, and because of that, the followers will be motivated in order to make new changes or to implement new ideas in order to make the changes. Let's see how leaders' behaviors and followers' behaviors are necessary for the changes in the health literacy policy. From the CEO perspective or a leader's perspective, a leader must demonstrate new ideas and initiations, provide guidance to the followers, make decisions, and inform that decisions. In that way, followers will trust in leaders' ideology, will accept the decisions that they made, and will perform the change for the benefit not only of the institution, but for the benefit of the patients and their families. Policy changes in health literacy will need strategies to make that changes. What kind of strategies can we propose in order to make that changes? One of the strategies is to increase information use. How we can do that? We can address the interactive and critical health literacy needs. We can share the decision making with the followers, and followers will share that decision making with patients and their families. Including integrated marketing communication will draw upon public relations and social marketing experts. Health education using internet and other multimedia channels will be a good strategy too, and increase social capital. Increasing the population's health literacy across multiple health contexts will result in a population being empowered to address a future challenges. Definitely, from the CEO perspective, they need to have new ideas to provoke that the population can empower to address future challenges in the different clinical settings. If the CEO have and provoke that positive changes, followers will value that changes, will be motivated, and will implement that changes. And that changes will be a benefit not only for the organization or not only for institution purposes. The big benefit will result for patients. Thanks for your time.